Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth-Hitchcock Medical Center, and I'm here to address some quick updates on COVID-19, as well as to answer some frequent questions that I've been receiving from staff and patients and those in the community. As we look ahead into the month of September, we are looking at models suggesting that we are going to see a rise in hospitalizations, both in New Hampshire and Vermont, that take us back to numbers at our highest peak in January of 2021. This is despite all of the efforts at vaccination, and what we're seeing is it's really those who are unvaccinated who are being hospitalized. And so this is the time to think, if you have not been vaccinated, come forward. We have availability. The vaccines are safe. They are effective. As we receive lots of questions about the Delta variant, it's important for individuals to understand why this is causing so much concern. Part of the reason is the Delta variant has led to higher rates of transmission. And so when an individual is infected with the Delta variant of COVID-19, they can spread to more individuals in their family, in the community, than with the original strain of the virus. In addition, we are seeing higher rates of hospitalization. And so for those who are infected with the Delta variant, and particularly those who are infected and unvaccinated, it's a higher rate of hospitalization and complications during that hospitalization. This is why the vaccine is so important at this time. I'm receiving a lot of questions about third doses of mRNA COVID-19 vaccines and booster shots of these vaccines. These are actually two different things. For those who are immunocompromised, meaning that they may be undergoing treatment for cancer, have undergone a transplant, or on medications that impacts their ability to fight off infections, we know that they don't have the same antibody levels after 2 doses. And so it's recommended as part of their primary series to get 3 doses up front. And so if you are immunocompromised and you receive 2 doses, you are eligible for a 3rd dose 28 days or more after that 2nd dose to make sure you have the same protection as others with an intact immune system. At the same time, we also recognize, as with other vaccines, we may be seeing antibody levels wane over time, and it may be that individuals in the general population will need a booster shot at some point 6 or 8 months after they completed their primary series. We will have more information of this as we go into September, and this is reviewed by the FDA and the CDC, but this would be similar to the type of annual booster shot you may get with influenza or the flu shot. If you receive the Johnson & Johnson vaccine, we are waiting on information. It is likely as we go through the fall that there will be recommendations around additional shots, but at this time, there are no additional COVID vaccine recommendations for those that received a Johnson & Johnson vaccine as their first shot. I'm also getting a lot of questions about travel and gatherings. And it really does come down to whether you are in an environment where everyone around you is vaccinated or not. So for example, if you're going to visit family or friends, you're vaccinated, you've been following recommendations for wearing a mask where you're traveling, and you get to the site and all of those you're visiting are vaccinating, you're at a much lower risk of contracting the virus as you participate in gatherings with those loved ones and friends in the community. However, if you're in a mixed environment where some people are vaccinated and others are not, that is going to increase your risk. Another question that we often get is around therapeutics and what you might take safely in order to help you recover if you were to become infected with COVID-19. We have many available therapies for those in the hospital, and even some that you can take after you've been exposed to help you from falling sick and becoming hospitalized. But one medicine that we're hearing a lot about is Ivermectin. And this is a veterinary medicine that is being used often in an uncontrolled fashion. You don't know what you're getting, the purity, the dosing, and we are beginning to see individuals who are actually sick from taking that medicine, which is not approved for COVID-19, rather than seeking medical care where we have approved therapeutics. There may be an indication to study things like ivermectin in trials, and that is actually something that's being done, but again, not in an uncontrolled fashion, and I warn people that we are seeing a lot of harm from this in the community and to seek medical advice from medical professionals. Finally, we are excited to see many of our children heading back to schools this fall, and public health officials have been working very closely with school administrators to think about how this can be done safely, and a lot of this is covered by the Children's Hospital at Dartmouth-Hitchcock website, chadkids.org. The CHAD leadership has released guidance for parents and providers to understand current recommendations on how to keep everyone safe as we open schools. We recognize that we have some in the schools who are eligible for vaccination and have been coming forward in good numbers, but we can still get more coming forward to get vaccinated as these schools reopen. We also recognize that we have a group who are under the age of 12 where vaccines are not yet available. And so we go into the fall waiting on information that should be available to say vaccines will be available, effective, and safe, and we'll come back to you as that information comes forward. Until that time, as community levels are high, I want to emphasize the importance of masks, and particularly masks indoors for teachers, staff, and students. I hope that we will get to a point during the school year where community transmission gets down to a point where we may be able to back off on masks within the schools, but that time is not now. As COVID-19 ramps up across New Hampshire and Vermont, we recognize that this is impacting all of us. I ask that you please remember that our providers, our staff, all of our employees are working diligently to make sure that you receive the care that you need. Please continue to visit our website, dh.org, for the most up-to-date information to stay informed. Take care.